How to know if your cat is pregnant, signs and symptoms. There are a few things you can look for to see if your cat is pregnant. Having kittens come into your home can be a happy and exciting time, but you should be ready and know what to do if you think your cat might be pregnant. The most effective way to find out if your cat is pregnant is to take it to the vet, but there are some things you can do at home to help. Here is a guide on how to tell if your cat is pregnant, with examples to help you understand the signs. 1. Changes in how cats act. As an example, your cat, who used to be active and playful, is now calmer and more loving. She might want more attention from you or like to rest in quiet, out-of-the-way places. A. Changes to the nipple. As an example, as you carefully look at your cat, you can see that its nipples have gotten bigger and pinker. This is one of the first clear signs of pregnancy, usually showing up 2 to 3 weeks after conception. 3. A bigger appetite. As an example, suddenly your cat starts eating a lot more than normal, like it's starving. Cats that are pregnant usually eat more because they need more calories to support their growing babies. 4. Putting on weight. As an example, even though you don't feed your cat too much, you can see her weight slowly but surely rising over the course of a few weeks. This weight gain is mostly because the kittens are growing and the mother cat's stomach is getting bigger. 5. Behavior of nesting. As an example, your cat starts to nest build by doing things like kneading blankets or towels to make a cozy place to give birth. She might also start looking for places to give birth, like nooks or quiet areas of the house. A swollen belly. As an example, as the pregnancy goes on, you can see that your cat's stomach is getting bigger and rounder. With a light touch, you might even be able to feel the kittens moving inside her belly. Being sick in the morning. As an example, some pregnant cats get sick and throw up, just like some human pregnant women do, especially in the early stages of pregnancy. If these things happen to your cat, it could mean that she is pregnant. And better vocalization. As an example, you may notice that your normally quiet cat starts to make more noise, especially as the pregnancy goes on. As the due date gets closer, she may meow more or use other sounds to communicate. 9. Changes in the feel of the coat. As an example, hormonal changes during pregnancy can cause small changes in the feel and look of your cat's fur. Some cats' coats get softer and thicker, while others may lose a little hair or mat up. And being restless and irritable. As an example, your pregnant cat may get more antsy and irritable as her due date gets closer. As she gets ready for labor, she might pace around the house, clean herself too much, or show other signs of stress. If you know how to tell if your cat is pregnant, you can give it the care and support it needs during this important time. If you think your cat might be pregnant based on these signs, you should talk to your vet to be sure and get advice on how to care for the baby while it's pregnant. If you pay attention to your cat's behavior and changes in her body, you can make sure that her pregnancy goes smoothly and that she and her kittens are happy. What should I do if I find out my cat is pregnant? As soon as you find out your cat is pregnant, you need to take a number of steps to protect her health and the health of her kittens. What you should do is this. 1. Make an appointment with the vet. As soon as possible, make an appointment with your vet. In addition to confirming that you are pregnant, your vet can also give you advice on how to take care of yourself during pregnancy. They may also give you advice on what to eat, how to get vaccinated, and what problems you should watch out for during the pregnancy. Change your diet and nutrition. For the growth and development of their kittens, pregnant cats need more food than usual. Your vet may tell you to switch to a high-quality cat food that is made. For cats that are pregnant or nursing, make sure that your cat always has access to clean water. 3. Make the place where they are comfortable. Make a place for your pregnant cat to rest and nest that is quiet and comfy. Give her soft bedding and a place to be alone so she can give birth and care for her kittens. Don't make sudden changes to her surroundings or add new things that could stress her out and cause problems with her pregnancy. 4. Keep an eye on their health and behavior. During her pregnancy, keep a close eye on her health and behavior. Keep an eye out for any signs of pain, distress, or complications, like having trouble breathing, throwing up a lot, or having an odd discharge. If you notice any signs that worry you, call your vet right away. Ori, get ready for birth. As the due date for your kittens gets closer, set up a birthing box or a safe place for her to rest. Put the box somewhere quiet and warm, out of the way of drafts, and line it with clean towels or blankets. Some things you should always have on hand are clean towels, scissors for cutting umbilical cords, if needed, and a heating pad or hot water bottle to keep the kittens warm. And learn about the birthing process. Take the time to learn about the birthing process and what to expect during labor and delivery. Learn how to spot the signs of labor, like nesting behavior, being restless and panting. Knowing the basics of what's normal can help you spot any problems before they get worse, and move quickly if you need to. Have patience and help others. Both you and your cat may feel stressed during pregnancy and childbirth. Be kind and patient, and if they need it, offer encouragement and gentle care to keep your cat from getting stressed out and lowering the risk of problems. Try not to handle it too much while it's pregnant, especially as the pregnancy goes on. Take care of your pregnant cat and get ready for her kittens coming before they come. This will help make sure that the pregnancy goes smoothly for both your cat and her babies. How long does a pregnant cat stay pregnant? There are about 63 to 65 days between fertilization and the end of a cat's pregnancy, which is also called gestation. It's important to remember, though, that this time frame can change slightly based on things like the cat's breed, age, and health. Cat owners often guess when the kittens will be born by looking at when they mated or bred. But keep in mind that mating doesn't always lead to pregnancy. A veterinarian's ultrasound or X-ray is the most accurate way to find out how far along the pregnancy is and when the baby will be born. These images can show how many babies are growing and how they are developing. It's important to give the pregnant cat and her kittens the right care and keep an eye on them during the pregnancy to make sure they stay healthy. Talking to a vet and following their advice on prenatal care and getting ready for birth can help make sure that your pregnancy goes smoothly. How long does it take for my cat to be well again after giving birth? It takes a mother cat, Queen, a few weeks to get back to normal, both physically and behaviorally, after giving birth. Here is a rough outline of when to expect things. Right after birth, maternal instincts. Right away, the mother cat will start to clean and feed her new kittens. This is something they do naturally and needs to do in order to stay alive. Discharge after giving birth. For up to a few weeks after giving birth, the queen may have a leak from her uterus. The amount and color of this fluid should slowly go down over time. The first week. Nesting. The queen will stay in the nesting area most of the time to care for and nurse her kittens. She might seem caring and protective of her children. Recovery and rest. All the mother cat will want to do at this point is rest and get better after giving birth. She might look like she's tired or not as busy as normal. Second week. More activity. As the queen's strength returns, she will move around more and may start to look outside the nesting area. Hunger. As she gets stronger, her hunger may grow, but she will still put taking care of her kittens first. From the third week on, things slowly get back to normal. The mother cat should start to act and do things normally again by the third week after giving birth. She might start grooming herself again and socializing with her human caretakers more. Wearing. The kittens may start to wean off their mother's milk and move on to solid food depending on the size and health of the litter. Most babies start this process between 3 and 4 weeks old. Ongoing care. Check up with the vet. You should take the mother cat and her kittens to the vet for a checkup soon, after giving birth, to make sure they are healthy and doing as expected. Spaying. You might want to spay your cat once her kittens are fully weaned to stop her from getting pregnant again and help control the pet population. While each cat's healing process is a little different, making sure the mother cat has a safe, stress-free place to stay, as well as good food and veterinary care, will help her get back to normal after giving birth. If you notice any signs or behaviors that are troubling during the time after giving birth, you should talk to your vet for advice and help. Thanks for watching. Please don't forget to subscribe. Let's meet again in new videos. Stay healthy